Hi, everybody. It's so good to see you all. My name is Matty Hemming, and I am a PhD candidate here at Penn in the English department and in GSWS. And it's with great pleasure that I welcome you to our last panel of the day, New Perspectives or Gender and Sexuality in Medicine and Science. I guess the new perspectives on gender and sexuality went, but I'm sure you are all offering new perspectives.
We'll try.
Yeah. So I'm a scholar of reproductive justice and the medical humanities, so I'm especially excited for this conversation today and to hear from so many folks from different parts of the university. I'm going to introduce you to our moderator, and then I'll hand it over to you, Jessica. So Jessica Halem is the senior director of is it Eidos or Eidos?
You did it right. That's right.
Eidos? Okay. LGBTQ Health Initiative at the University of Pennsylvania, an innovation hub that increases the impact of startups, nonprofits, policymakers, and business leaders to improve the health of LGBTQ plus people. Previously, she was the inaugural LGBT director at Harvard Medical School and the executive director of the Lesbian Community Cancer Project in Chicago, where she served on then-candidate Obama's first LGBT committee. Jessica holds a BA from Sarah Lawrence College and an MBA from Simmons University.
Great.
Okay, over to you, Jessica.
Maddie, thank you so much. I had asked Maddie to talk about your work, but we'll do that next time because I love it. It is so exciting to be here celebrating the 50th anniversary of this program because I, too, am 50 years old and having a hot flash this entire time. And so maybe that says something about this program. Hormones, hormonal, all of us to the front. 50 years old I'm just getting started, right? We're just reaching the point where we've healed our wounds. We have no regrets, right? So I think, turning 50 is actually the most powerful position to be in.
Amen.
Can't be more excited for this program for the next 50 years as I am my own. I am a student of gender and women's studies, sexuality studies. 30 years ago, I graduated from Sarah Lawrence College. It not only made me a raging queer, but it made me somebody really, really dedicated to how all of this wonderful theory and important information manifests on our bodies. And I've spent the past 25 years working in the LGBTQ health equity movement. I'm so proud of that work. And I'm so proud to be on a panel today of really the future of what is happening today on the ground. This is boots on the ground people who are pushing the fields of science, medicine, health, and healthcare. I couldn't be more proud to say the issues that we just heard so beautifully discussed and problematized in the earlier panel. This is a group of people who are really trying to manifest some of those problems. As solutions. This is a solutions-oriented panel, but they are very, very aware of the problems, and they are very committed to figuring out solutions. We have a little bit of a fun way we wanted to do this. We did not prepare remarks. I really wanted this audience to get to hear firsthand about the work that this incredibly diverse panel is working on, thinking about, engaging in, to hear from you all. I'd really love to be able to have lots of time for you all to engage in this work. I've asked the panel to introduce themselves and to describe their work, to really paint the picture of the work that they're doing, either the problems they're addressing, the questions they're trying to answer. We've got a graduate student on the panel, so we'll put all that pressure on you, and to really show off their work. I really am so proud to be on this panel of my colleagues. So, Dennis, I'm going to ask you to go first.
Good evening, everyone. I'm Dennis Flores from the School of Nursing. Can you hear me okay?
Yeah.
Okay. What do I do? So essentially, I work on ways to help cisgender and cis straight parents be more inclusive in the sexual socialization of their youth who happen to be LGBTQ. Pretty much for most of history, we get socialized into social beings in a way that assumes heteronormativity. And my work kind of nudges parents or reminds them of the ways that they could be actually factual and germane, also for youth who happen to be LGBTQ. And this work is informed by, so my background is actually, my first degree was in psych and sociology. This was a degree that I received in the University of the Philippines. And to this day, I think for, 3 of the 5 working days, it's that psych and social background that I utilize in my work. So in the last few years, we started with formative elicitation studies to essentially ask the question from LGBTQ adolescents, what was their experience as they were in the household learning about how it is to be a sexual being, the ways that they're socialized. And then the second part is really focused on figuring out how might future cohorts of LGBTQ youth be affirmed and supported if they so happen to be LGBTQ. A lot of parents nowadays a lot of them, but not overwhelmingly, are aware that perhaps there's a plot twist of sorts when they realize that their youth may have same-sex attractions or may identify as LGBT, and some of them actually do want to have resources available. And so that's the work that we're doing out of the School of Nursing, really arming them with 2 things. The specific topics, the sexual health topics that is more in line with the emergent attractions and behaviors of their queer child, and then the ways to communicate those specific topics. Because they can parrot information that they see from the CDC, but if they're not compelling or they look like they're sincere in providing this health information, the young people will just tune them out, right? So it's this tandem task that I'm focused on in my lab, really addressing the needs of these emergent needs of parents who are trying to raise LGBTQ youth. So that's me.
Well, you left, sorry, I know folks, so I'm going to prime you. Dennis, you left out your nursing part. How you understand this sort of in practice part. Tell the folks about that.
Sure. So yeah, I graduated from my psych and social background in the Philippines, and then moved here to the States in Georgia, and realized that as a gay man in my early 20s, working as a social worker of sorts was not going to sustain a lifestyle I wanted. Sorry, but it really was like an issue as a 22-year-old. So I decided, and it's a Filipino thing to go into nursing. And so I decided, yes, let me go ahead and go back to school for nursing. And I was a little bit more keen on using that second degree for members of the community. So HIV and AIDS is a big thing. And I knew that I wanted to work in that setting. So as a bedside nurse in the last HIV/AIDS unit in the Southeast, this was in Atlanta, I worked there for a few years. And essentially, as a young gay man working in that unit, 42-bed, a lot of our typical admissions were essentially my peers coming in with what was called full-blown AIDS. And I remember, getting tired at some point because I was in 5th grade in the Philippines when HIV was first introduced to us in my science class. And then fast forward to several decades later, here I am with these American-born gay males seemingly not having heard of HIV. So I was just curious, how is it that I was overseas, I heard about this, it put the fear of sex in me, and how was American education failing my peers here in the States? And then initial studies showed that they were not receiving queer-specific sex ed. And so that is how it got started. But because sex ed in school systems is a hot mess in the US, it's always been, I figured let me go into other space where I can also at least nudge parents a little bit more. So I ended up with family-based sexual health discussions.
Yeah, I love how you weave that all.
So it's nursing and trying to get parents on the same page as, even if they're in full denial, a lot of our folks are coming to us to say, how is it that I should be able to communicate these important facts?
Awesome. All right, Lori, you're the graduate student.
Yeah, I got a seat at the big kids table somehow. So, and because I was nervous, I wrote down some things. So, just for the overview of my work, because I'm not as used to giving my elevator pitch as everyone else on this panel. So my interests are kind of multivalent, but the primary unifying focus is that I'm interested in the identity formation of queer and gender diverse youth. And I do so through examining how chosen family, queer elders, and identity concordant clinicians can promote psychosocial and behavioral well-being, particularly in terms of harm reduction and positive imagined futures. And I'm also really passionate about using critical theory, system dynamics, and various other kinds of mixed methods to conceptualize moral distress of gender-affirming care providers, particularly in this legislative hellscape that we are living in, and leveraging implementation science to improve the service delivery thereof. So in service of that, I'm getting in addition to being in my third year of my PhD in social welfare with my advisor, Amy Hillier, I'm also getting an implementation science certificate through Perlman. And I serve as a multi-year LEA Fellow, Leadership Education and Adolescent Health at Children's Hospital of Philadelphia. I'm also a grad fellow in the Center for Teaching and Learning here at Penn, a fellow in the SexGen Lab, an associate fellow at the LDI, Leonard Davis Institute for Health Economics, and I'm newly appointed to the board of Q Caucus, which is through the Society for Social Work Research. And I'm subcommittee lead for the GLAMA Health Professionals Advancing LGBTQ Equality Providers and Training Curricular Reform Committee. That's a hell of a mouthful. And also a co-founder of Q Care Lab with Dr. Scott Jelinek, who is also at CHOP and a LEA Fellow. And Q Care stands for LGBTQ Collaborative for Advocacy, Research, and Education. As part of that lab, we have a bunch of different projects. One that I'm particularly proud of, which as of yesterday got the SPR Richard R. Lowe Award for Clinical Research, is inclusion and privacy in practice. So confidentiality concerns regarding sexual orientation and gender identity collection in youth. And so we are looking at kind of examining the attitudes of collection, storage, and use of SOGI data, essentially. We also got $20,000 in funding from LDI for that pursuit. And we're working with the Possibilities Project at CHOP to improve the Adolescent Health Questionnaire, which on March 1st will be tomorrow, going live with additional SOGI questions, and that goes out to about 38,000 kids a year across the CHOP enterprise. Some other projects I'm working on, I have an oral history project that I'm working on with the Center for Guaranteed Income, looking at oral history amongst LGBTQ elders in West Hollywood. I'm working with a street med outreach team in St. Louis, focusing on harm reduction. I'm working on a scoping review of peer support services for sexual and gender minority youth with behavioral health needs. I have a number of projects related to queer bioethics, looking at biopower and necropolitics, and how that is functioning vis-a-vis anti-trans legislation. And I also got $30,000 in funding from Penn Mental Health and AIDS Research Center for a project called Understanding Psychosocial and Behavioral Constructs related to PrEP interest among transmasculine people assigned female at birth. And that'll basically be the armature for my dissertation, which is tentatively titled, Who's Your Daddy? Exploring the relationship between harm reduction, chosen family, and positive imagined futures. And I'll pause there. Yeah.
Well, I just have to comment that it is so exciting to see in the field of STEM how much the influence of what we're talking about, gender, sexuality, and women's studies, trans studies, has made it into these fields. And I wish that we could show all of the young people around the country right now, all of this incredible health and medicine that you are influencing and involved with. It's wonderful. So it's the future is bright. Mm-hmm. Ari, thank you. Amy, it is a joy to get to share this stage with you. We owe you so much. Please share with us.
So I'm Amy Hillier. I'm a faculty member in the School of Social Policy and Practice. So I didn't get the memo that social work didn't pay well, Dennis. So I've just stayed there. No comments on how he looks versus how I look. I should say, maybe I'll describe a little later the plot twist in my professional career, which involves my child's gender identity. But I think I'll say that for the next question that you have. But just to say that I have my research, which I'll tell you about in a minute, but I consider the most important work that I can do as a tenured faculty member in social sciences and social work, is to try to create space for people like Ari who are rocking it, who are challenging it. And I know I have a lot of respect. The last panel, folks were talking about their book, their next book, like what Ari just described, serving on lots of committees, being at all kinds of national conferences, getting grants. Like this is what you have to do in this field in STEM and medicine and public health. And so this is what success looks like. I mean, it's a hustle. I know in the humanities, you have your own version of that hustle, but it's a hustle. And so as a faculty member, I feel like the most important job for me is to create space and support doctoral students and graduate students who are here to do that work, because I feel like, I can kind of a glimpse at it. But I'm really proud of Ari and other folks, some of your colleagues and some of the other students I've had in the work that you all are doing. The project that I thought I'd mention, the primary research that I'm working on now in this field, out of social work, with some colleagues in medicine and psychology, is and you might all have strong reactions, but it's a screener. It's a measurement instrument around measuring gender identity and distress among parents and kids, young kids. And so I think we share a lot of the same commitment about how do you help parents move along in the journey. And I'm particularly interested in gender identity. I haven't been looking at sexual orientation, and with kids under 12, so often where they don't even really have a clue yet about a fully formed idea about sexual orientation. And how do we move them along on the journey? My hope is that we can get physicians to help with that process, that if physicians or in a pediatric well visit, parents are being asked to think about their child's gender as being part of their health profile, just like you're asking, do they eat, or, doing a weight check, to ask how if they identify, how they identify their gender, and if the kids are feeling distress about that, and if the parents are feeling distress about that. I mean, that the parent distress is often the most problematic part of all of this. And my model was, as a 6-year-old, I still remember my pediatrician asking me, Amy, do you wear seatbelts? And you might say, what does seatbelts have to do with gender? But like, it made such an impression on me that my pediatrician was saying, seatbelts matter. Seatbelts are about health, right? And so to have a pediatrician or a nurse practitioner, someone else in that, what to me is a very trusting environment. I mean, not for everybody, but to have them have a conversation about gender. And so I've tried to learn how to do now I'm even forgetting them, psychometrics, right? Psychometrics in terms of how do you actually come up with a measurement tool that has validity and reliability, that passes kind of the sniff test for medicine, and also the folks in this room who are like, I know trans, right? You're going to put this in 4 questions in a pediatric office. So the one thing I'll just say, what we've succeeded in so far is showing that parents actually can tolerate these questions. Most of them have. We have a publication that came out yesterday in Transgender Health that shows that 85% of parents in a national sample across race, ethnicity, who they voted for president in 2020, part of the country that they live in. The mom's a little more supportive than the dads, but overall people were supportive. Now, there is about 5% of our sample was deeply entrenched and not interested and hostile. So I'm not going to say that work is done, but we are. I've been at it I've just put in my 5th grant proposal to the National Institute of Health. If you want to talk about humility, it looks like constant rejection, which is I'm not alone in having, and still hopeful that we'll be able to move this ahead and actually be able to pilot this in Children's Hospital. And if you told me 10 years ago, 20 years ago, this is the work I'd be doing, I would not have believed you. And I'll say the last thing in terms of like thinking about how you describe this hellscape, I think was where this is some great language up here, this hellscape of legislation and what's going on politically. So my colleague from the University of Michigan, who's the psychometrician on this project, who didn't know a lot about gender identity, he just wrote to me today and said, oh, the article came out yesterday. My communications team wants to know, like, can we have a press release? And I'm thinking, do we really want to advertise that we are doing research about gender identity? Like what kind of trolls is that going to bring on us? And so like where the science meets the politics is a pretty tricky place. So.
Yeah. Tricky place, Karen? You got a tricky place you want to share with us?
Yeah, I love tricky places. Hi, everybody. So I'm Cam. My primary appointment is in the Department of Bioengineering in the School of Engineering and Applied Science here at Penn. I have secondary appointments in electrical and systems engineering, physics and astronomy, neurology, and psychiatry. I'm really interested in trying to understand. Oh, sorry. You want me to kiss the microphone more? Okay. I'm really interested in trying to understand how the brain is organized and how we can use tools from engineering and physics to understand that brain organization. So most of my work focuses on neuroscience and specifically uses neuroimaging, so images of the brain, to try to understand differences among us, how brains change with age, how they differ in a variety of clinical conditions, and variations in mental health. The two places where gender becomes important in the work that I do are in understanding brain structure, but then in also understanding how science is done in my field. And so I'm going to separate my comments into those two sections. In the first, this is relatively new work that is being led by Elvisha Damala in collaboration with Avram Holmes, who's at Yale. And it's using data that has been collected from 5,000 9 and 10-year-olds across the United States. And this is an ongoing study funded by the National Institutes of Health to try to understand child development and specifically brain development. And so these 9 and 10-year-olds will be followed for the next 5 to 10 years. So we'll have information about how their brains change, a lot of information about their family situation, about their education, about prevalence of a variety of health conditions, inflammation, stress, etc. So it's a very exciting time to be studying brain development in my field. As part of that study, several scholars developed a questionnaire for the 9 and 10-year-olds and for the parents of the 9 and 10-year-olds. I was not part of the development of this questionnaire, but I was part of the analysis team examining them. So to give you an idea of what people are asking now in a big study like this from NIH, I wanted to read you a couple of the questions that are being asked of these 9 and 10-year-olds. The first set of questions is related to self-report of gender for both assigned male at birth kids and assigned female at birth kids. I'll just read the assigned female at birth ones, but you can imagine what the inverse would be. So one question is, how much do you feel like a girl? How much do you feel like a boy? How much have you had a wish to be a boy? And how much have you dressed or acted as a girl during play? These are the 4 questions that are asked of the kids, the 9 and 10-year-olds. And from that, the scholars gather a self-report measure of whether gender variation and also whether gender expression is congruent with sex assigned at birth or incongruent, and to what degree. In addition to those 4 questions, there are questions that are being asked of the parents. The parents are asked, does she play with girl-type dolls, such as Barbie? Does she play with boy-type dolls, such as action figures? Does she experiment with cosmetics, including makeup and jewelry? Does she imitate female characters seen on TV or in the movies? Does she imitate male characters seen on TV or in the movies? Does she play sports with boys, but not with girls? Does she play sports with girls, but not with boys? Does she play girl-type games as compared to boy-type games? And those are in quotes again, air quotes. Does she state the wish to be a boy or a man? Does she state that she is a boy or a man? Does she talk about not liking her sexual anatomy or private parts? And so those are the questions that are being asked of the parents in this study. So I think one interesting question is how those questions were being developed, and also if there are changes to those questions that could be incorporated or additions that could be incorporated over the next 5 to 10 years of this study. So it's a sort of opportunity for change. But with that data, what we did is to ask whether and to what degree the answers, the self-reported gender answers or the parent reports aligned with sex assigned at birth. Again, to what degree? What we observed is that there's greater congruence in assigned male at birth children than assigned female at birth children. And this is a finding that has been reported in sociology for quite a long time. But it's interesting to see it in 5,000 kids in this quantitative assessment. It also varies significantly, the congruence between sex and genders varies significantly across the United States. So in areas that are more metropolitan, there's less congruence, and in areas that are less metropolitan, there's more congruence, which is interesting. The next question was, how are those data aligned with brain structure and function? And what Alicia observed is that there are correlations in brain anatomy with sex, and they're located largely in areas that are important for motion, for audition or hearing, and for vision. So that is one place in which gender becomes important in the work that I do. And then the second area is trying to understand how we do science. So in work over the last couple of years, we have been examining the perception of other scholars' genders, which occurs implicitly for many of us from the names of those scholars. So when we see a paper that has a particular name, we will often implicitly assume a gender of that person. And that is something that many of us are trying very hard to remove from our cognitive processing, but is something that's very consistent across the variety of, or the majority of people in the field, and including us sometimes. And so what's important then is to ask how that implicit perception of a scholar's gender may impact how we engage with their work. And what we find is consistent evidence that for people who have a name commonly given to assigned female at birth people, those individuals are consistently undercited in the neuroscience field in comparison to people who have a name that's commonly given to an assigned male at birth person. So there's a striking perceived gender gap, such that individuals who are perceived as closer to being women are undercited and men are being oversighted. We also see a similar variation according to perceived race and ethnicity, such that the individuals who are most undercited in the field are those who have a first name that's commonly given to an assigned female at birth person and have a first and last name that have language variations that are reflective of non-white race and non-Hispanic and Hispanic ethnicity. So this is a place where non-binary and trans identities are difficult to bring into the study. However, distinctions between the perceived gender in a binary is something that we can detect in the data and is something that the field is now consistently working to address. That includes work by journals trying to emphasize to authors that they consider the equality of their reference lists, both in terms of gender and in terms of race and ethnicity. We also actually see strong variations with institutional prestige, which is another factor which is really important to address as well. So that's being done at the journal level. It's also being discussed at larger scale levels, including the NIH, where grants are often given to people who have certain citation metrics, and that is a conversation that is sometimes had around the review table, even though it's not something that is seen as a good quantifier of whether a scholar is careful and rigorous and successful. So at the funding, in funding bodies, there are ongoing conversations about how to incorporate this information into the evaluation of scholars for funding. So those are the two places where it comes up for me in the work that I do.
It was awesome. What should we be doing? You're giving me a signal. You're just ready to go whenever ready. Okay. Oh, good. Oh, good. That's how I like it. That's how I like my GSWS. I'm curious, Cam, about it would be interesting to study the very few folks who are having getting their names actually changed and going back to their peer-reviewed journal articles. It's been a big fight, and a lot of people are winning it. Trans folks in medicine, especially, it'd be interesting. Ben Vars has that great story after he transitioned, and he was in an elevator, and somebody was saying his work is so much better than his sister's work, and it was all his. It was all his work. He had a great sense of humor about it. So I think, do we want to go to questions, or is this lively? What should we do? What can I get a temperature check besides the hot flashes? Should we have a conversation? Are you ready to dive in? Okay, great. I can see that people are chomping at the bit. So maybe let's go to the audience and keep it going. Who's got up here? Oh, good. Everyone's just waving at me. Okay. Who's got a? Great.
Interest. Periods for all of work, like one is like trust more and so ownership. And then the question, what impact will more use from the more.
It's so good. That was my next question for this panel, Beans, before you had said it. So who would like to go first? Dennis, you have thoughts?
Sure. Yeah, I love that. So as I mentioned earlier, in so many ways, I feel like I'm utilizing my psych and sociology background more often than the actual nursing training. And so I do actually have collaborators as well in the humanities, in the social sciences, because it also informs the language that we provide to parents in terms of these are the best ways to express this point. And in addition, I think the examination of human behavior is always essential for us when we're designing these interventions. So for example, we've got one that's funded by Eidos, which is Parents Assist, a series of videos geared for parents that mirrors for them how to engage in conversations, sustaining those conversations, having the appropriate facial expressions, et cetera, right? Like we're really giving them a guidebook of sorts. But it is in the understanding of what are the typical reactions, for example, to disclosure, or the conception of disclosure as a one-time coming out event when we know that it's actually not the fact. People go through multiple disclosures across their lifespan, the lifespan. And having an awareness of that from the social sciences, I'm always citing literature, not just through PubMed, but across all of the other databases we have, because that's where we get the insight. So it's utilizing all of the rich findings from the social sciences mainly that helps us situate our work so that it's more grounded in reality and not clinical, not just the clinical portion.
So I was actually an English and art history double major in undergrad at Bryn Mawr with a couple of the people in this room. And so I think that the training I received in critical theory and queer and feminist theory really is integral to the way in which I try to do the scholarship I'm enacting now. And I wish that more people in medicine had any kind of background in like Foucault or Judith Butler, or like even just like low-hanging fruit, like, sex and gender are different. Like the bar is low. So what I would aspire to is having conversations around, Beans, your work around the history of how we got here is so important for where we're thinking, like how we're conceptualizing what is currently happening and what are the possibilities for where it's going to go, both positive ones and not so positive, right? And so when I think about some of the history that is necessary in terms of like trans people have been around forever, and just because Foucault created the this idea of like the homosexual doesn't mean that suddenly here we are. And so so pushing back on these categories, which are so definitive in quantitative research and in medicine, and then thinking about how some of the power structures and strictures are at play, and how that then is playing out on bodies. And I mean, thinking about necropolitics as informing medicine. These are some of the things that I am trying to interweave in my own thinking. And also, I've been out of college for longer than it looks. So, and so I am missing some of that queer theory and trans theory and like what is on the cutting edge of the humanities, because I wasn't able to take those classes while I'm also trying to get a PhD. So please come talk to me and collaborate with me so that we can continue to move this work forward.
Great. That's a great message.
Yeah, I really appreciate the question. I think just whoever had the idea to have this panel, right, was thinking that these disciplines need to be in conversation. And particularly, I think social sciences and public health and the humanities. And I mean, I studied as a history major undergraduate, and still come back to that. And I collaborate with folks in the humanities, but not around my research around transgender stuff. Like, so, yeah. And I think there is some tension, right? I think in terms of and I'm not going to say that anything that was discussed on the panel before is not timely, but in terms of I'm in a professional school where we're doing applied work. And I know exactly where I cited your work, Beans, in a paper that I wrote about embodiment and erasure on eco-social theory for public health and thinking about LGBTQ. And that's a rare paper for me to write something sort of conceptual like that. So yeah, I think that not being afraid of the tension and not being afraid to talk about the ways that that it feels like this sometimes. I mean, that's definitely my experience sometimes being at GSWS events. I'm like, what the heck are they talking about? I mean, really, and I know I'm not alone, but maybe in this room I am. But just, yeah, and I think that Ari represents a bit more of that like synthesis, but to figure out ways, like that we could have PhD students who could actually be doing GSWS and certificate and doing that cutting edge theoretical work with the PhD. So anyway, thanks for the question.
Yeah. So I think, I love the question also. I think that like some of the other panelists, I think I would welcome more input from other disciplines or other scholars in other disciplines to the work that we are doing. I think that is, I love interdisciplinary work. I love working with people across disciplinary boundaries. So I think there's a lot more room to be doing that in my work and in others that I know of near what I'm doing. I do work and have been working a lot with my twin who's in philosophy. His name is Perry Zern, and he's in the Department of Philosophy at American University. He works in trans studies, specifically in trans history and trans philosophy. And so I've had a lot of conversations with him about gender. Well, actually, for much longer than we worked together as colleagues. So that is one place where concretely I have regular conversations, but I do welcome interactions with others too. I think I really like your second question too, which is what is it that we in science on the ground science today in neuroscience specifically could use? And I think what is critical for us is quantitative measures. So what is it that we can measure? What are the questions we need to be asking on the surveys? What are the concrete things that will produce data? And that I know that there's a conflict in some sense because many of these things are just, okay. The fact that you laughed means you know. Yes. So, but that is kind of what I think we also need, and then a way of couching that quantitative data carefully and framing it carefully so that it's so that we minimize the potential for it to harm others.
I just want to give a shout out to sort of thinking also about how we work sort of in parallel paths sometimes. So everyone in this room feels great about the numbers and the data that came out of the latest trans survey. And there were real scientists who worked very, very hard on those questions, like very hard on those questions. And they weren't perfect. And you took it and you were probably a little cringy at moments, but that data, there's sort of like a parallel drive, I think, that we're all doing around taking up space. And so I just do want to say, as someone who struggles with this tension every day, that it's not about getting it right or the wrong, but it's about the sort of like all the tools in the toolkit that we're going to use to do this. And I would just sort of say, my work, as you know, I've been working for many, many years training doctors, literally one-on-one training doctors what to say and what not to say. And it's the languaging of the nuance that is the hardest, that I would love to sit and have that workshop, right? I don't want to put up my slide anymore with my definition of gender identity. It's cringy. Congruence, alignment, I say vibe sometimes. Like, I'm just trying to say, like, it's a vibe. I hate my slide on gender identity. It makes me, I hate my slide on, you know what? I have a great story about, I was in a survey. I'm a longitudinal lesbian survey. And the first time, I'm a longitudinal lesbian now. The first time I got to test into the survey, the researcher had a scale of lesbian. Like, was I lesbian enough to be in the survey? And I'm not at all a gold star. That was the issue. So I was just like, oh my God. She's like, so when was the last time? I'm like, oh my God, is this a lesbian scale? Like, am I getting scaled about whether or not I can be in this longitudinal study? And I passed, and it was the greatest moment of my life. But anyway, I don't care about any of that. It's stupid. But all is to say, there's just this, it's terrible. It's awful. I hate it every day. But at the end of the day, we do need language. We do have to figure out how to concisely language this stuff. Whether it's in an instrument that will really help us move the needle on the real care that you need to get from the health insurance company, or if it's actually getting, scientists to understand, gender in our everyday lives. We have to figure out how to fit it on a slide. We have to figure out how to fit it on a slide. I'm sorry to say.
Inverse of these is museums the universe.
Mm-hmm.
So every semester, I heard from in our intro, where sexuality compels are the center of culture, and that might be what's view. And so we try to kind of like intro to matters and like a credit course, and
Here's your clitoris.
we're a bunch of like humanists.
You
like,
believe me? They know you.
I was thinking with is
Yeah.
about it when and so I guess like just advice would be really like an overall.
I love it. What would the scientists do in an intro to women and gender studies class in Baton Rouge, Louisiana? I've been to your gender studies department. I love it. It's great. Yeah. What would you do? What would you teach to those wonderful young people?
So as a nurse, I do first an assessment of where they are.
Yes.
And just get a grasp of, okay, who's at this level that we don't need to cover the basics, and then who's like badly needs one-on-one sex or whatever it is that they need. And then also get a map of the resources that you have. Hopefully the campus has other resources that can, that you can refer out some folks. I think I'm always about harm reduction. And it's always a given to me that the first few weeks of a new academic year, there's a rise in STI diagnoses because of just the nature of that age group, of human behavior, but just making sure that they have full awareness of what the resources are, coming from preventive health, or even if something does, people get diagnosed with STI or whatever it is, just giving them a landscape of, all right, you're figuring out your identity removed from your home. How about your identity as a consumer of healthcare? And that's something that is part of what we're trying to get parents to start having a conversation with about. Like, as you're ready to launch in your final years as a teenager, let me empower you to make that appointment for yourself to go to a doctor or buy that testing kit at Walmart, at Walgreens, or wherever, so that you kind of know what health behavior looks like. It's normalizing that, hopefully without all the baggage of gendered, just all of these one-sided and really problematic ways of thinking.
That's great.
So that's exactly how I would start with that. But always just normalize conversations, because in so many ways, chances are this is, when they get to you, it's the first time they're having these out conversations with each other about behavior. And just fostering that, I think, is always a positive thing. Good
Young
luck to
person,
you.
Ari. What
Yes.
do the humanists teach?
Well, actually, I used to be an English teacher also. So, and so I had a lot of young people come into my classroom having very little exposure, frankly, to any conversations around this, and coming from a variety of backgrounds and family, like social mores. And so one of the ways that I tried to structure my curriculum was through windows and mirrors. It's really important to have a window into a world other than your own, but also a mirror for the parts of self that should be valued and reflected. And so I think that especially in kind of circumnavigating, like being like the sneaky, like public health, like trying to get people to understand what consent is when you're not allowed to have that conversation. You can do a lot through storytelling, and you can do a lot through literature. You could do a lot through documentaries. And I think it's important not to show those stories not in a pathologizing way, but rather that like this is the full panoply of human experience. And also we can learn we don't have to make every mistake ourselves, which I think most 18-year-olds need to hear. So, I think there are ways to kind of like sneakily give them information. The other piece I would say is that there's a lot to be said for elders. And so even if you as an employee of the university can't say XYZ, somebody else can. And so if you're creating a conduit for young people to have access to elders, particularly when they share those identity valences, whatever they may be, that there's going to be a lot of education and mirroring that can happen there too.
Pass.
That's great.
Health education.
Keep it up. Keep it up. Keep up the great work.